Do you have pain on the outside of your hip, right around the bony bit? Well, in this video, we're going through the best exercises you can do for this, and also some important things you want to avoid to help get this better. Hi, my name is Rob from AMR Physio, and this condition is labelled as Greater Trochanteric Pain Syndrome, or GTPS for short. I swear, they just give things fancy names so people can sound a bit smarter. But it's this bony bit that's on the outside of your hip, which is called the greater trochanter, and it's basically saying you've got pain around that area. They use this as a more umbrella term. It used to be called Trochanteric Bursitis, which is basically like an inflammation to a bursa. And you've got loads of bursa that are on this bit of the hip. And bursa basically are cushions to help things glide past, which is really important. Otherwise, you just have bits of muscle getting frayed on the bone over time. We have them all over the body around loads of joints. However, it was also deemed that it might be down to one of the tendons in which you have, and a lot of those attached to that area too. So rather than putting it all down to the bursa, they gave this umbrella term to cover both. And we have 5 exercises that you can do for this, and we'll also go through other important things you need to start implementing for this condition to help improve it. So make sure to stick around and watch that too. With these exercises, you want to go to a level that isn't increasing any pain during or following the exercise. For number 1, we've got isometric hip abduction. So you'll do this up against the wall. You want to bend the leg that's closest to it and press it into the wall. This will get the standing leg doing the work to stabilize. Adjust the amount of pressure that you're putting through to minimize any irritation. It shouldn't be painful. If it is, just don't press as hard or take this out if it's too much. Exercise number 2 is a bridge. You can start this doing it double leg, so knees bent, feet on the floor, pushing your bum up off the floor, hold and then slowly lower. If that's too easy, you can progress this to work on a single leg bridge, but make sure to build this up slowly and go back if it's too much. For number 3, you can use a seated hip abduction machine. So with the knee bent, pushing the weight out to the side, this will be in most gym settings. Hold at the end of the movement for a second and then slowly return. You can adjust the difficulty by changing the weight on this. The next 2 exercises are more for later stages of rehab, and sometimes starting too early on these can aggravate things. So if the pain is starting to settle a little bit and you're wanting to build things up, then move on to these next 2. Number 4 is crab walks. So you put a band around your feet, going into a slight squat position, and then with a big step sideways, follow with the other leg in a controlled way. Do the same number in both directions, gradually building with the reps or with a stronger band for a harder resistance. Number 5 is step downs. So for this, standing sideways on a box, you'll slowly lower your other leg to the floor. Keep your toes up so the heel touches, so then there's less temptation to push off that foot, as all the work wants to be done by the leg that's on the box. Work on keeping your leg in a straight line without the knee going in to try and get more glute activation here. You can progress this by going to a higher box. So these are great exercises to work on, but there are also some things you want to limit or avoid doing to help this in getting it better. And it's the things that can commonly irritate this condition, of which we are going through 5 of them. Number 1 is not crossing the leg. So if you imagine the midline of your body, you don't want to cross the affected leg over that midline. So that may look like not crossing your leg in a seated position, but also if you're lying, not crossing the feet over. Number 2 is not sleeping on the affected side. This can add pressure if sleeping directly on that side, which can irritate it. But also think about if you're sleeping on the other side, that affected leg can drop down, effectively crossing the midline again. So use a pillow or something in between the knees to help with this. Number 3 is not standing for long periods and hip shifting. So spending a lot of time on your feet, you'll naturally shift your hips from one side to the other. And this can be really irritating if you keep hip shifting onto the affected side. So if you can, break this up with sitting as much as possible. Number 4 is not walking long distances. So many people come to us with this and think that walking will help things, as a lot of the times we are always told to walk more. However, with this, walking can be irritating for some people, and the distance can be so variable, so you can't say the exact distance you shouldn't walk, but you may need to reduce a bit. And we're not saying don't walk at all, but it's just if it's irritating, you will need to do less. The last one is running and jumping. The same really applies to this as with the walking, but this you want to limit even more until things start to settle, and then you can add it back into later stage rehab with a very graded progression. So now you know the best exercise to do and how to not irritate it. Rather than repeat the same things in loads of videos, we have nailed down in this video here to go through how many reps and sets you need to do on these exercises and when you should progress, along with other ways to approach modifying your activity to not irritate things.